Instruments in Obs-Gynae Part 3. This is Leach-Wilkinson's cannula, the instrument which is used for tubal patency. It is a straight instrument and it has got a conical tip. It is used for hysterosalpingography, for chrome perturbation and laparoscopy, and for hysteroscopy. Another instrument which can be used for the same purpose is Paediatric Foley's catheter. The catheter is inserted, the bulb is inflated, this blocks the cervix, and the dye is then pushed. Here, the trauma is less. There's no trauma actually. Then the general instruments. This is a Cheatle forceps. It is used for holding sterile instruments, drapes, swabs while giving to the operating or arranging the operating area. This is towel clip made of stainless steel, sterilized by autoclaving or boiling, used again for keeping the drapes in place. The sponge holding forceps. The sponge holding forceps are long forceps. The end is having fenestrated blades and there is a lock. It is made up of stainless steel, used for painting, cleaning, draping, swabbing deep cavities like vagina and the pelvic cavity. In gynecology, the application is for pressure over deep bleeding points during pelvic surgery, and it is also used to check the hemostasis of the stumps during hysterectomy, for packing away the omentum away from the site. In obstetrics, it is used to catch the pregnant cervix during tightening of the os, then to visualize the cervix properly in cervical tear, to locate it, and also while stitching. It is used to swap out blood from the uterine cavity. This is a straight artery, as you can see, and it can also be curved. So it has got a tip which is having serrations throughout. These are used for hemostasis, for holding structures like peritoneum, rectus sheath, vessels, muscles during any operative procedures, and also for suture removal. This can be used for clamping placenta at the after delivery of the baby. This is a Bart Parker's handle with knife. It is used for giving incision, popularly known as the surgeon's knife. Different sizes of the blades are attached, and larger sizes of the blades are used for larger tissues and incision, and the smaller blades are used for fine incisions. Commonly, the 10 scalpel blade is most commonly used. There is an acute angle number 11 blade which is used for stab incisions, for draining of the breast abscess, Bartholin abscess, etc. This is the Allis tissue holding forceps. Now here there are the multiple tooth, and this is the lock, and it comes in different sizes. Generally, it is used for holding the rectus sheath while opening and closing the abdominal wall. In gynecology, it is used for catching the edge of the vagina in cases of the repair of anterior colporrhaphy, enteroceal repair, colpoperineorrhaphy, in Fothergill's operations, repair of vesicovaginal fistulas, to hold the cervix, then even in abdominal hysterectomy, to hold the tips of the pediatric cervix, to hold the uterus, vaginal and abdominal hysterectomy, myomectomy, Marchetti's test for detection of stress urinary incontinence. In obstetrics, it is used for holding the uterine wall during cesarean section. So when you're repairing, you hold the angles and the uterus with the Allis. It is also used for correction of acute inversion of the uterus. This is a right angle retractor made up of stainless steel. It is simply used for retracting the abdominal wall. It's used in tubal ligation and to retract the bladder and the posterior vaginal wall during hysterectomy, to retract the bladder during abdominal hysterectomy. This is a Deaver's retractor. Now it is flat, it comes in different sizes, and it has got a curve to meet with the abdominal. So this part is put inside the abdomen and the person holds here. So the hands are away from the side and the tissues are retracted. The tooth forceps. This is a thumb forceps with the tooth on its tip. This is used to hold tough structures like tendon, fascia, skin, rectus sheath, uterine wall, and this can be used for hemostasis. Needle holder. The needle holder is having a small tip, and you can see that in the tip there is a groove and there are serrations. This is in order to keep the needle stable, and there is a lock also to keep the needle stable. You sterilize by autoclaving. Now this is the way the needle is held at the junction of anterior 2/3 to posterior 1/3, and the needle is fixed or it gets stabilized at this point in the tip. Surgical scissors. This is a surgical scissor. These are having study scissors used for cutting the tissues. The blunt ends do not damage while separating the tissues, and it is used for cutting tough tissues like rectus, parametrial tissues, vaginal cuff. The curved scissor, these are used when you're working in depth for cutting adhesions, incising the vaginal cuff in abdominal hysterectomy. These are the stitch removal scissors. You can see that the tip is very fine and it is curved. This is in order to remove the stitches. So what the stitches which you have already applied, you cut it from this tip. The stitch is hacked into the serrations by passing the blade beneath the stitches, and they are cut by hooking them. The free ends of the knot are held with the forceps to lift the suture. This is a metal suction cannula. So if you could understand, please subscribe, drop a like and share. Thank you.